The foreskin in men could be a problem in some patients. I am Dr. Subramanyam, consultant urologist and transplant surgeon at Apollo Hospital, Jubilee Hills. We do see a lot of patients who have got problems with their foreskin. We also know that a big section of population who practice Islam get their foreskin removed at birth, and this is for religious reasons. But all the other communities do not remove the foreskin on a religious basis or on a routine basis. And these patients do come to us sometimes with problems with foreskin. Now we get two sets of patients who have got problems with foreskins. One set of patients who are in the prime of their life, where they want to get married or have been recently married, and these patients come with complaints that the foreskin is tight, and when they pull it back it hurts, and sometimes it's so tight that when they pull it back it tears, the tip of the skin tears, and that produces problems. And these patients would have problems having intercourse, and also the intercourse is painful and would probably be very unsatisfactory for them. In these patients, the only option is circumcision. Circumcision is where we remove the foreskin, the whole foreskin is removed so that the glans or the head of the penis is exposed. Now these patients come with a lot of myths. Sometimes the biggest problem these patients have, which lasts for about a week or 10 days, is a bit of sensitivity of the glans. So when the foreskin is removed, previously the glans or the head of the penis was covered with the foreskin, and therefore it's not touching the undergarments, and now the head of the penis is touching the undergarments, and this will produce a slightly unsatisfactory feeling for people for about a week or 10 days. And usually in a week or 10 days the sensation would go off, and these patients would probably come back to normal. The biggest problem with the biggest myth these patients sometimes have is whether we can do it at this age. They have a concept that foreskin is removed only in children, but we do circumcisions in elderly people, adult people, because if they produce a problem, the only problem with the foreskin, the only solution would be to remove it, and removing it is a very simple procedure under local anesthesia. Now there are a lot of hype about different ways of doing circumcision or removing the foreskin. People talk of a routine classical procedure which is very commonly done. People also talk about a laser circumcision, which is a very expensive way of doing just what is normally done with the traditional way. People also talk about what we call a stapler circumcision, again a very expensive way of doing what is normally done. There is also something called a plaster bell, a plastic bell like thing, where you put the bell and tie the a string on the top of the plastic bell so that the skin slowly comes off. These are all just unnecessary procedures, and from the patient point of view there is hardly any difference, and most of these procedures are being propagated by different gadget makers who develop these staplers and things like that. An ordinary circumcision, which was done traditionally for many years now, is equally good, if not better, than most of these things. Now the other problem which these patients sometimes do come and ask us is, once the skin is removed, will it grow back? Now once the skin is removed, it is removed, that's it. It won't grow back, and there is no reason for it, or there is no necessity for the skin to grow back. So these patients who have difficulty in pulling the foreskin, or particularly difficulty where the foreskin is very tight and tears, particularly during sexual activity, would probably better off getting a circumcision done. Now the other biggest group of patients where a circumcision may be necessary is slightly elderly people who are diabetics, who get recurrent infections in the foreskin. Now if somebody comes who is about 40-45 years of age, comes with an infection at the level of the foreskin, we would always go and check his blood sugars, because this could be the first sign to say that they probably are diabetic, and more often than not when we check the sugars are usually quite high. So this could be the first indicator to say that the patient is a diabetic. So if we get patients who are about 40-45 and who comes with infections and the foreskin, we always check the blood sugars, and more often than not these people are diabetics who require control of diabetes. And in spite of diabetic control, some of them continue to have infections, and again circumcision would be a good option in these patients to prevent further infections. So circumcision is a simple procedure. Circumcision is a procedure done under local anesthesia. It's a procedure done as a day care. It is a procedure done with very little or zero complication rate, and doesn't require all the new hype of gadgets like lasers, staplers, plaster bell. All these things are not necessary. Most of the circumcisions can be safely, very effectively done by the traditional way under local anesthesia.